Okay, so today I'm going to talk to you about our CO2 laser COMax. So this is a very versatile machine, okay? This works on 10,600. With this one here, it is so versatile. You can use it for skin lesions, you can use it for cherry angiomas, you can use it for skin tags, you can use it for moles, you can use it for any benign lesions as long as they've had clearance from a doctor. With that, it is very easy to be used. So with this device, it's very versatile in the sense that you can move it. Its slim design allows you to be able to fit it into little tight spaces. It's on wheels, so it is not heavy. It's not going to hurt your back at all. So you can move it. And what I love the most about this, that this handle rotates. So you can always have it like this, and you can work on top, and you can do your client if you need to remove any skin tags. Your settings are not being touched. So with this slim design, you can fit it virtually anywhere. The wheels, you can take it from room to room. You can station it in one room like what we do here. But for me, we like to have it positioned in one section, and I can easily wheel it out, bring it close to my client, and it takes literally 5 seconds to set up. So with this one, you get 2 sizes here to do your skin tag and your mole removal. Personally, I like the thin one because I have much more control and I can hold it. As you can see, the handle does rotate, so it doesn't matter what angle you need to get to. It is beautiful and it's easy to use. This is a thicker one, so this is usually for bigger moles if you want to get in there because it gives you like a bigger wavelength, so you can go into it directly and you can do it. As I said, personally, I love the smaller one. I feel like I have more control. The other thing that is also attached to this machine that you receive, you get your client goggles for patient safety. I usually apply a fibrella and that on top. And then we've also got the technician glasses that just goes on like that. So with our fractional, so as you know that this device can do the cutting mode, it can also do fractional. So you can do a full resurfacing, you can do a gentle resurfacing as well as a medium strength resurfacing. So when we're dealing with the body and specific scars, you can use the bigger attachment. We also have a smaller attachment that can be beautiful for just under the eyes or just above the eyebrow or around the mouth as well. And then we generally have the medium size one, which is great, what we use for the entire face when we're doing facial resurfacing. Now I'm going to show you how easily this can be attached and how effectively this is done. So all you need to do is just remove this here. So this will come off like that. You just unscrew it. Just like that. We have our other attachment here, which is the handle for the actual fractional. You attach the size that you want. So for instance, I'm going to be doing a facial resurfacing. And as you can see, that just attaches on there. And it screws on nice and easy. Not all these buttons and gadgets and different things to attach. It just goes on there ever so easy. Just like that. And you're virtually ready to go. With these ones, I just attach them to the machine. They've got little clips, so it's nice and versatile. And you can still do this. Move the machine closer to you, and you can do a facial resurfacing. I generally hold the tag, and I can go over the face just like that. And if you want to change, and you want to do under the eyes, you just take the attachment off, swap it over, just like that, and you can go under the eyes, so you can go directly under the eyes, or you can go across the mouth. Nice and easy. So when you're cleaning the device as well, it is very easily done. All you need to do is just alcohol wipe the tip. Even with the skin tag, all you need to do is just clean that up just like that, and you're good to go. The only thing that touches the face is the pointer, nothing else touches. So as long as you can clean that. If you want to, for example, put these in the autoclave, they are autoclavable, so they can go in and they're safe and they're durable and they're not going to damage. Alternatively, an alcohol wipe is sufficient. And also, when you're about to turn on the machine and you're about to start your client, you can wear a face mask because it does evaporate. There are fumes that go into the air and you might not want to actually smell it, and the client might be laying there, which is fine for them, but for yourself and for your safety, have the aircon running, have it at a good temperature, put your face mask on, that way you're not smelling any dead skin and you're good to go. Let me put this here. Okay, so when we're turning it on, it's very simple. Just turn the key. Nice and easy. It will come up with the top settings. We always touch the corner and you have two settings here. You have your cutting mode as well as your fractional. So if we want to do a skin tag or a mole removal or a cherry angioma, we go into the cutting mode. Our settings are here, so our energy according to our protocol. For example, with cherry angiomas, I like to keep it at a 10 millijoule, and our pulse interval in terms of how long the pulse width is, I like to put it up to about 40. Anywhere between 40 to 43 is perfectly safe. For me, I like to have the light level low, so you can adjust it as much as you want to. Personally, I like it on 3. Because when the light comes through, I don't like it to glare too much, so I like it on a low setting. When I want the laser light to come through, I can turn it on through here. I know now that that's on. And when I'm ready to go, I turn on the on button. For safety reasons, I like to put the machine on standby when I am stopping. If I need to alter settings or touch anything, always put the machine on standby. Alter your settings, turn it back on, and proceed with your treatment. So this is our foot pedal here. So it's very versatile. I just place it generally in front of me, and that way I've got full control over the device. Okay. Now I've got it on a fractional setting. So just for today, just so you guys can actually see what I'm doing, I'm going to put the density up. So these are your different shapes here. So you can do a square, you can do a rectangle, you can do a triangle, you can do a circle, especially for the sides of the nose where people tend to get a lot of blackheads. I love to use the circle for that one. I've also got the diamond, which I like to do between the eyebrows. And then you've got a line, which if you want to do lines underneath the eyes where you don't want to do bigger shapes, you can go directly with the line and do just a few lines under the eyes and you're targeting specific areas. So all these shapes can be done on different shapes of the body and on the face as well. So for today, I'm going to show you the square on a 14 joule, 12 by 12 density. So remembering that the density is the coverage that I want. I'm going to take it off here. I'll just change this attachment because this is a 2 by 2 area. So now this is ready. So you might be able to see the little red light flashing. So that is the square. I'm going to show you also the circle so you can see it. So you've got disorder and order. So this is order where it shows you very organized. This is a little bit more scattered. So I'll do a disorder in the circle just so you have a comparison to be able to tell the difference. So they're lined up differently. I feel for me, the disorder is a little bit more all over the place where I like it because it's getting every region, whereas the order in itself is a bit more structured and measured. So let's have a look at a different shape. So it's very easy to use the screen. So we'll just do that one. Wait, no, because that's on. So this setting I like to personally use under the eyes. So you can see that there. And you can see the fumes as well, just like that. So what I want to do now is I want to put the joules up to about 20, and I've got 24 by 24 density, which is basically a full resurfacing. So just to give you another comparison of what this is going to look like. So this will stay on the skin for a lot longer, and I will do it just underneath the other ones. Ready? So that is the difference between a lighter setting and a full ablative. So this is fantastic when you're trying to do scar revision as well. You would do the cutting mode, or stretch marks as well. You would do the cutting mode, which is the other attachment, followed by this one directly on top.